Hello everyone, it's Dr. New York Bundia. A lot of people have questions about Draymond Green's leg injury and how it can be tied to his lower back. Here's a quick breakdown of the anatomy of the back, the prognosis for these injuries, and what you do in terms of treatment. Now the first important thing to understand is that when an athlete actually gets injured in his lower extremity, you obviously first want to look at that lower extremity area. So for an example, in a calf, if an athlete's complaining of calf pain, you want to see if the muscle is damaged, if the tendon below it is impacted as well, or if there are other structures that may be basically causing the pain. If the degree of structural damage or physical exam isn't consistent, then you want to look at the back. Now, why would you want to look at the back? Let's go to a quick breakdown of the anatomy of the back. The back is basically made up of vertebrae, which are the bones, as well as discs, which are basically between the vertebrae and act as cushions. Now, when an athlete may be engaged in repetitive activities, such as a football player, an NBA player over a period of time, or there may be one acute injury, what can sometimes happen is those discs can actually protrude back from the vertebrae and then impact the nerve roots. Now the nerve roots are basically areas from the spinal cord that actually give sensation and strength to the muscles of the lower extremity. So when an athlete has a disc injury, what can happen is that those nerve roots can get inflamed or can sometimes get compressed. This basically then impacts the signal to that area of the body that is innervated by that nerve root. So take this for example. If you have a herniated disc at the nerve root area that basically gives sensation and powers the calf, then what can happen is the calf can have pain and that muscle can get weaker. So a lot of times what can happen is an athlete may have a little bit of a calf injury, but they're having more pain than normal. You actually go up to the back and actually see that a disc is actually herniated in that area because those nerve roots that give sensation or power to the calf are impacted. So what are the goals of treatment? Well, the goals of treatment are basically to get rid of that compression or irritation of the disc on the nerve root. The first line treatment for this is physical therapy and rest, and that can help the inflammation and sometimes the compression go down, and that calf pain or any muscle symptoms the patient may be having will go away. If that doesn't work, then sometimes you'll do injections to help decrease the inflammation in that area. Only in worst case scenarios do you do surgery to basically address that disc. So it's important to understand, even though the calf muscle may be completely normal, if the nerve is basically impacted from the disc at that area, it can actually give calf pain or leg pain in other areas based on what anatomical area is impacted. In general, if we look at NBA players, the good news is that when NBA players have herniated discs in their lumbar spine, almost 80% of them return to play. If you look at operative versus non-operative treatment options, there isn't much difference in terms of outcomes. The one group of players who are most impacted are centers, largely due to the fact that likely it's due to weight and the stress across their lumbar spine. The key is understanding that even though the calf muscle may have some degree of damage, a lot of times pain or dysfunction can come from the fact that the nerve root, which supplies that area, is actually irritated. And then you basically need to treat that by getting rid of that inflammation and compression, hopefully non-operatively, but there are operative options as well too. Thank you.